speaker would be Dr. Lucas, experience in the use of biological agents and TNF in treatment of psoriasis and psoriatic arthritis. Study with 18 cases.
Hello, good afternoon. I'm very happy to be here. It's really great to be in the World Congress, and I'd like to say thank you to the opportunity to be here. And I'm here to talk to you about our study with 18 cases about experiencing the use of biological agents and TNF in treatment of psoriasis and psoriatic arthritis. The biological agents appear with mechanism of action more specific than the other available conventional treatments so far, and being able to control the psoriasis and psoriatic arthritis better, and to guarantee the control of this disease in the long run, with significant improvement of the quality of life of these patients. And this study has an object to evaluate the effectiveness of the treatment of psoriasis and or psoriatic arthritis with the use of biological agents like TNF, etanercept, infliximab, and adalimumab, and to evaluate the satisfaction in patients during or after the treatment. This was a retrospective study with from August 2005 to February 2007, and 18 patients. It included with psoriasis refractory to other treatments, with or without arthritis, and that presented any incapacity or significant decrease of life quality, and were versions of treatment with immunological agents. 18 patients were studied, in which 11 men and 7 women, and 5 patients used etanercept, 6 infliximab, and 7 adalimumab, and the ages varied between 24 to 68 years old, and the average time of illness was 10.2 years, and 15 patients had associated joint symptoms. The longest average time of treatment was 28.4 weeks with etanercept, and the dose respectively we can see, and the degree of satisfaction was good or excellent in 83% per patients with infliximab, and all the patients had good therapeutic response, and the joint improvement exceeding 2 turnovers. In this case, we can see a severe psoriasis with associated joint symptoms, and the patients had easy using with infliximab, and we can see that she had a good response. We didn't observe any incapacity, collateral effects, and it's important to say that we didn't observe any kind of infections, just a few light case of nausea, 1 case of xerostomia, but there is no evidence between this kind of symptoms and biological agents. And it's important to say that we had in one case, the therapy was changed from infliximab to adalimumab because after treating for 8 weeks, the patient became unresponsive, and a switch to adalimumab was necessary. So in conclusion, the psoriatic arthritis and psoriasis management must be individualized to the degree and type of joint pain and inflammation, and in general, the conventional treatments still represent the first-line treatment. The biological agents and TNF, such as etanercept, infliximab, and adalimumab, represent the most recent major advance in the clinical management of both disease. And in our study, the patients have shown excellent results, which have positive effects not only on joints, but also on the skin when affected by psoriasis and on the quality of life. Thank you very much.
Yes, come from Brazil, and I would like to know, you have a special reason to choose these different biological agents to this different population. What your reason to choose this or that?
Actually, we don't have choice, because in Brazil, it's the government that pays the treatment for the patients, because these drugs are still expensive, too expensive for them. And in our service, the patients come to our clinic, and the nurse that make an application to the patients. And we know that infliximab has better results, because the way application, the way administration is endovenous, and the patients have faster results, like in 2 weeks. So, but the choice is we ask the patient and say to them about each one, but the final choice is of the government and of the patients. We don't have difference.
Yes.
Were these patients on any other treatments at the same time?
Yeah, the patient, these patients don't use only this kind of medicine and biological agents, and we do like with treatment with methotrexate, and like if we have joint symptoms associated, we can use anti-inflammatory drugs, but not only biological agents.
Yes. I just one question. In Brazil, which systems do you use before biologics? What methotrexate?
Yeah, methotrexate is the first one.
Yes. Thank you very much.
Thank you very much.
Then the next speaker is, according to the program, supposed to be Dr. Klein from United Kingdom, but I don't know. Well, let's continue to Dr. Tang from United States. And he will talk about comorbidities in patients with psoriasis or psoriatic arthritis.